3 News Now Web Extra.
I'm a co-executive director of the Global Center for Health Security and an infectious disease physician at UNMC.
Awesome. Well, we are looking into some of those COVID cases that have already popped up in some of the school districts that have started. A lot of schools just started, last week, even some as early as yesterday, and we're already seeing COVID cases. When you hear some of those numbers, I'm not sure if you do have those numbers, but Millard has 52 COVID cases today. Westside has reported 7, and they started yesterday. Another school district has 10. When you hear some of those numbers, what thoughts, what feelings come up?
Well, certainly concerned. Concerned about the level of transmission that we already have in the community. And I'm concerned about the vulnerability of kids and their families when we're sending kids back to school in full density in-person classrooms without face masks, and for most of them without vaccines. Certainly children under the age of 12 don't even have the option of being vaccinated. And our vaccination rates for middle school and high schoolers from 12 to 18 is still rather low, well below where we need it to be to prevent the spread of COVID-19 in that population. And so unfortunately, what we're seeing is entirely predictable. You cannot expect a highly transmissible respiratory virus like Delta variant to not create explosive epidemics in school settings where that is the highest density of any place in our communities in terms of people per square foot, right? A primary school classroom has a population density above any other environment. Hospitals, offices, prisons don't have the population density of a school classroom. And so we know that respiratory viruses transmit exceptionally well in that environment, and you cannot expect a full classroom of kids who are not vaccinated and not wearing masks not to have these types of huge outbreaks. And people, I just think, have been maybe not paying attention, or maybe just listening to information sources that aren't accurate or reliable in thinking that we were going to have any other outcome than what we're seeing now, and what we'll see, which will be higher rates of these clusters. And it is more evident and more obvious with Delta variant because it's a worse virus. It causes more severe disease. So kids are developing more symptoms than they did previously with the original strain of the virus. I think we had outbreaks that were probably almost as extensive last year in schools. Certainly we were doing more. We had some schools that had face masks required for all students. We had better distancing, so we probably had a slower burn of outbreaks in many of those schools. But the reality is kids get infected just as easily as adults. We just don't count them. We don't detect those infections because kids don't get tested at the same rate as adults do. If you look at antibody studies, more kids have antibodies against the virus in their blood as a proportion than do adults. So kids get infected at a higher rate, and they do because they're in schools. And that's where this mixing occurs. So we're going to see this continue to get worse in school populations, and that's going to translate into more cases in the community. That's what happened in the UK with Delta variant. Kids drove that epidemic wave in the UK earlier this summer, when kids in the UK are actually still in school until the end of July. And that's what's going to happen here unless we take action and put in place layered interventions like masking, reducing classroom density, avoiding large gatherings, cohorting students. If we can do those things, we can create a safer school environment, and we can reduce community transmission. And then we need to do things, well, first of all, certainly boost our vaccination numbers, which is the most important tool we have to prevent spread. But unless we do those things and do them rather quickly, we're going to end up in the same boat as Florida and Mississippi and Alabama, where in many of those communities, there are no ICU beds left, none. And so that's not just COVID that doesn't get treated. That is heart attacks and strokes, car accidents, emergency appendicitis cases, right? Those ICU beds, we're not running around with a huge surplus of ICU beds normally. And so that capacity is going to be overwhelmed quickly. And then you're going to be getting your treatment, or your loved one's going to be getting their treatment in a tent. And that's probably not good care right there.
And you mentioned how important masks are, and as we know, a lot of these school districts don't have mask mandates. The only one in the metro area that has required it for all students is OPS. Some do require it for the elementary school kids, but a lot of these kids have older siblings and stuff like that. When I have gone to these board meetings, a lot of them have told me that they're in constant contact with local health officials like yourself, Nebraska Med, CHI, as well as some of those health departments. But they still decided to not have those mask mandates. So when they say that they've been in close contact with all the local health officials, but then at these board meetings announce that there is no mask mandate, as a health official, as one of the faces of this pandemic and the response to the pandemic, how does that make you feel when these districts kind of go against all the guidance and suggestions and information that you guys have given them over the past year and a half?
Well, I think we're used to it now by a year and a half. We had a meeting of an informal meeting of most of the infectious disease physicians in the state of Nebraska this week, as we are talking about how we can improve our communication and outreach to the community. And that caucus was unanimous in our assessment that universal face masks are necessary for schools. There was not one dissenting vote. So I think that the consensus of the experts is pretty clear. Don't know what else to say.
You also mentioned some of those vaccine rates, especially in those kids who are eligible at 12 to 18 range. It's not the best. Those rates are still pretty low. And again, as I go to all these school board meetings, there's a lot of misinformation that these families have. What do you think it's going to take at this point? What can we do to continue to get the right message out, to what do you think it's going to take to get the vaccine level to where it needs to be, especially in these kids?
I think education and messaging is an important part. I do think that there are a lot of people out there who really can be, we can connect with, and we can convince that it is in the best interest of their child, it's in the best interest of their family, certainly in the best interest of the community to get their child vaccinated and to wear face masks in school. There's a small proportion, I think, that is going to be impossible to reach, but we don't need to get to 100%. Certainly, I think that mandates and requirements in school systems, which have a long history in the public health arena, right? We all know that you have a series of shots that you need to get if you want to enroll in school and go to public school in Nebraska and every other state across the country. And so I think that type of mandate and requirement is warranted here. We know that type of intervention works. It worked with seatbelts, right? We didn't get massive adoption of seatbelts, and the benefits of that, which have been dramatically reduced motor vehicle accident deaths in the US until we had seatbelt laws that went in place. So in some instances, I think there is an appropriate role for action at the state and local level to make these things, make these types of things compulsory. And I think this is clearly a case. If we don't do that, and again, if we don't correct course soon, regardless of how we do it, we're going to end up where Florida and Mississippi and Alabama and Louisiana are right now. And that's going to be catastrophic, right? That lots of people are going to die unnecessarily, and the community is going to suffer. And it doesn't have to be that way.
And a lot of these schools have said that their COVID back to school protocols are fluid and that they're continuing to monitor the situation, but they haven't really given a benchmark as to when that shift will take place. What benchmark do you think schools should be looking at the point where they say, this is the time that we need to change our protocols?
Any reasonable benchmark that one would have set to trigger those things, we passed a long time ago.
And you've touched on this, but I just want to kind of reiterate, where do you think now we're headed into? You know, like I said, school just started for some kids yesterday, and there's already cases in those schools. If we continue down this road, what are we seeing, and what's that timeline looking like?
I think that we are only at the start of this epidemic wave. We're maybe 3 weeks in. If you look at where we really started to take off in terms of growth, it'd be helpful if we had better information from a dashboard that showed us what those daily case numbers were. But I think that we can expect probably another 5 to 6 weeks of growth. And maybe longer with the opening of schools. That is probably going to amplify and extend our epidemic wave. So if we think it's bad now, just wait until a month from now. And we're going to see a lot more cases in schools. We're going to see a lot of schools that are closing or suspending operations because of kids who are isolated and quarantined. We're going to see a lot more kids sick in the hospital. We're going to see a heck of a lot more adults sick in the hospital, mostly unvaccinated. And we're going to see our health systems overwhelmed, and we're going to see the use of contingency care areas, again, potentially even tents in the parking lots of hospitals, because we don't have enough beds and we don't have enough staff. And so, again, our healthcare that we're going to be able to deliver in that situation is not going to be great.